Welcome to 50 Plus in Montgomery County, a monthly program that is a voice for many, produced by the Commission on Aging, of which I am a community member. While the show is insightful for people of all ages, each episode takes a fresh look at important issues by spotlighting older adults in the community, representatives of services and programs, and activities of interest to older adults. My name is Katie, and today our discussion will be twofold. First, we'll focus on our show's new name and refresh. Second, we'll have discussions about mental health awareness. October is National Depression and Health Screening Month, and we will highlight a few important mental health topics in our discussion. I also want to take a moment to say the Commission joins in celebrating Hispanic Heritage Month. We remain committed in enabling older Latinx adults to connect with the multicultural and multifaceted communities we all serve. Joining me today and here to talk about our show's new name change and refresh is Eddie Rivas. Eddie is the Vice President of the Commission on Aging. Hi, Eddie.
Hi, Katie. How are you?
I'm good, and yourself?
Good. Thanks for inviting me.
Absolutely. So, Eddie, why did the Commission on Aging decide to change the name of Seniors Today to 50 Plus in Montgomery County?
Well, Katie, it came down to the name senior. That title carries a lot of different meanings to a lot of different people. 30 years ago, when I was working in Oakland, California, I met an African-American woman who I actually asked if she minded being called a senior. And her response was enlightening to me. She immediately said, I ain't never been a senior, nothing to nobody. Call me an elder, call me an older woman, but don't call me a senior. And I thought, okay, the American Indians like to be called elders. A lot of indigenous cultures call their people elders. And elders is really a sign of respect and acknowledgement that the individual has a lot of wisdom they've earned over time. The commission, we're really concerned about older adults in the county and different forms of discrimination. And, older adults carry a reservoir of skills, talents, expertise that we've earned throughout our lifetimes and still want to contribute back either through jobs or through community service. So given that the term senior really is pejorative, especially in the workplace and in the media, we thought it was time for a change.
That's interesting, Eddie. I like it. And you gave us a lot of good context. Now, considering that, tell me a little bit more about the work the Commission is currently working on.
Sure. The Commission on Aging, as you know, is chartered both by the county and federal law to be the advocates for all aging issues in the county. Recently, we've started to address the issue of expanded home and community-based services, especially for those older adults who are neither rich nor poor. And by that, I mean people who can't afford to either pay for high-cost services, but still have enough assets they don't qualify for public support like Medicaid and other public assistance. So a lot of programs like adult daycare programs, home health care programs, home chores and home care activities of daily living, all those things cost money if you can't do them yourself or don't have a relative or a friend to help you. So that's something that we're looking at to really broaden the context of how the county provides those services. And we're looking at we're looking both at the private sector and the public sector. And a great example of that is the village movement in the county. Montgomery County government has been really good about supporting villages in Montgomery County. We've got over 30 villages in existence or in development. And what villages are small, nonprofit, membership-driven organizations that offer support either in services or whatever, and social engagement to individuals who want to remain living in their homes for as long as possible, and it's safe and they can maintain good quality of life. So those are examples of the kinds of home and community-based services that are out throughout the county. And another thing that really leads from that is simply that we as a county need to do a better job of marketing all the great services we have in the county already. The commission, we've learned as new commissioners come on, how many folks who are on the Commission on Aging don't have an idea of the multitude of services that the Department of Aging and Development and Disabilities has to offer. And so we want to really make sure that when somebody picks up the phone and calls 311 or dials directly into a department, that people are ready to give them information, and we have to get that information out throughout the county in whatever capacity we can, through the media, through radio, the internet, but not everybody has access to the internet. And then the last thing that we're really going to be working on this year as a budget issue is trying to make sure that the Housing Initiative Fund, which was created some years ago to preserve and produce affordable rental housing, gets more money. We're going to be advocating for that with the county council and the county exec in his office. So those are like the principal things that in the next fiscal year, we're really going to be working on.
That sounds really good, Eddie. Is there anything else you would like to share with us today about being 50 plus in Montgomery County?
I think the one thing I would share is that I would ask people watching this show, be they older adults or be they young people, to keep an eye out for your neighbors, look out for them, do some advocacy for them. We on the commission do a lot of advocacy. As a matter of fact, we're going to be hosting the Maryland State delegation to the General Assembly sometime this fall for a legislative breakfast. Tell them what our priorities are, listen to theirs. We do the same thing with council members. And we have public forums and we try to educate the public about different issues as well. So those are the kinds of public education the commission's really trying to incorporate as much as we can.
Eddie, thank you so much for coming and sharing about the ongoing work of the commission and the premiere of our new name. You're right, we have to look out for our neighbors and advocate for one another so that we can keep Montgomery County great as it already is. Thanks so much for taking the time, Eddie.
Thank you very much. Take care.
Up next, we will talk with Regina Morales. She is the Deputy Chief of Behavioral Health and Crisis Service and Director of the Local Behavioral Health Authority for the Montgomery County Department of Health and Human Services. Welcome back to 50 Plus in Montgomery County. Joining me is Regina Morales. Regina is the Deputy Chief of Behavioral Health and Crisis Service and Director of the Local Behavioral Health Authority for the Montgomery County Department of Health and Human Services. She's also the co-leader of the Montgomery County Suicide Prevention Coalition, of which she will talk more about today. Hi, Regina.
Hello, Katie. It's such a pleasure to be here.
It's a pleasure to be able to talk to you. Now, Regina, can you tell us about the Montgomery County Suicide Prevention Coalition? Briefly describe what it is and the work you are doing.
Absolutely. Thank you. Yes. So the Montgomery County Suicide Prevention Coalition is something that was born at the concern of many community members and providers and stakeholders during the pandemic. There were many of us that were worried about the mental health of our community members, and especially about, the potential of increased suicides. So we joined together with the idea of uniting our efforts towards decreasing stigma for mental health services, behavioral health services, and increasing awareness that there is a lot that can be done when people are feeling upset, when they're feeling in crisis, when they're depressed, and that we can help each other and prevent suicide. This year, the way that the Suicide Prevention Coalition organized itself this year is that we had different subgroups. We had subgroups that met for adult issues, related to adult issues. One subgroup met related to youth issues, and one met related to older adults. And we created a lot of promotional materials to let people know that our website has a lot of information that people can access if they are concerned about someone, if they want to know what to do if someone is probably in crisis, maybe just concerns that they're going to have a suicidal thought, or that they're having suicidal thoughts.
Regina, what are the risk factors, warning factors, and protective factors for suicide?
Sure, and these are really good to know when you're thinking about is there someone I'm concerned about? Risk factors include, having a history of mental health disorders, but really having access to a lethal means, such as a firearm. It could also be knowing someone who died by suicide or social isolation or chronic disease. But there are also protective factors or things that are likely to prevent suicide, such as really good and effective behavioral health care, feeling connected to your family and to your community. And it could also even be cultural or religious beliefs that discourage suicide. So warning signs, things you should be looking out for. If someone's mood changes, where they're anxious, they have a loss of interest in things that they were interested in before. If they speak or post about feeling trapped or feeling like they're a burden or feeling hopeless or having no reason to live. And if their behavior changes to where there's an increased use of drug and alcohol, or they're acting recklessly, or they're withdrawing from others, changes in sleep pattern, giving away prized possessions, purchasing a firearm. These are all things that you want to be thinking about when you're thinking, should I be concerned about someone?
Now, so if you are worried about a loved one and they're in pain, what sort of action steps can be taken?
The most important thing is to think about. There's always a fear that if I ask someone, are you feeling suicidal? Are you feeling like you might want to end your life? That we're going to give that person that idea. And that's not true. The most important thing is to ask them, are you thinking about ending your life? And if they tell you that they are, ask them, if so, have you thought about how you would do it? By knowing the answers to those questions, you know that there's a high risk and that you should, at that point, do what you can to keep that person safe. And again, if there are 5 steps that are found to be very helpful in terms of helping someone if you want to help someone who you're worried about. And it's asking them, keeping them safe, being there for them, listening to them, helping them connect to resources, and then following up. And all of these things are something that you can either call the crisis center and give you that information and have someone walk you through how to support your friends, or the hotline will do the same thing. And you can also go to our Be The One website and obtain more information about what to do, how to follow these 5 steps when you're worried about someone.
So Regina, you mentioned the 5 steps, and within that you talked about connecting to resources. Can you tell us about the resources that are available and where an individual or loved one can go for help?
Absolutely. And remember, these are all confidential. So the Montgomery Crisis Center is open 24/7, 365 days a year. And I can give you that phone number. It's 240-777-4000. They can also talk you through how to help somebody you're concerned about. The Montgomery County hotline, and you can look up everymind.org. They have phone, text, and chat services. So if you don't want to talk to someone on the phone, you can text with a counselor. And the national 1-800-273-TALK is another resource that's available.
If someone wants to get involved with the Montgomery County Suicide Prevention Coalition, how can they do that?
So we would love to have them just contact me directly, and I'd be happy to talk to them about the coalition and also get them involved in our email distribution, and talk to them about what we're doing. And
Regina, what's your information?
Absolutely, please email me. It's regina.morales@montgomerycountymd.gov.gov.
Well, thank you for sharing about this public health concern. We've learned that suicide is complicated and it's tragic, but it's often preventable, as you stated, with asking questions to our loved ones and friends who we think may be in pain. And knowing the warning signs and how to get help can save lives. Thank you so much for taking the time, Regina.
Thank you so much for having me.
Up next, we will talk with Liz Necka, who is the Program Director in the Individual Behavioral Processes Branch within the Division of Behavioral and Social Research at the National Institute on Aging. Welcome back to 50 Plus in Montgomery County. Hi, Liz.
Hi, it's nice to be here.
It's great to talk to you. Liz, there are several factors that pose distinct impacts on our mental health. particularly isolation and loneliness. Can you help us understand the difference between the two?
Yes. So social isolation is a lack of objective social connections. So that could be not having many social relationships or infrequent social encounters. Loneliness is a feeling of being isolated, and it's independent of whether or not one has objective social relationships. So you can be lonely in a crowd, you can be lonely even if you're in a relationship, but it's the feeling that you don't have social connections, sometimes described as a discrepancy between the social connections that you want and the social connections that you actually have.
What are some of the tips for staying connected, particularly in the times we find ourselves in?
Yeah, it's really challenging. The past year and a half has really challenged all of us to stay socially connected. One of the ways to stay connected is to really invest in relationships that are important to you. And that can mean if a phone call is going to help you maintain that connection with that person, go ahead and do that. Try to find ways that you feel are comfortable to engage in social connections, maybe outdoors. Sometimes though, when you're feeling particularly lonely, you might not necessarily feel like you can reach out to people. You might get in your head about that. And in that case, it's important to remember that just to take a step back and try to reevaluate your perceptions of your social encounters so that it doesn't feel so overwhelming to engage in a social connection. You can engage in social connections if you're objectively isolated by joining community groups. There's a number of resources that can connect you to your community that are available online. And then just investing again in those relationships that you already have to strengthen them even further.
Now, Liz, what are some of the health effects of loneliness?
So loneliness and social isolation are associated with a wide variety of negative health effects, including high blood pressure, heart disease, obesity, a weakened immune system, risk for dementia and Alzheimer's disease, suicide, and early mortality. So people sometimes think, well, oh, that's something that's not related to my physical health. That's just something that's social. But your social connections are really important for your social health. What happens is that if you don't have social connections, that's really stressful because we're social creatures as human beings. And so if you don't have those, that's putting a lot of stress on your body, and your body reacts to it in a way that it causes an increased immune response, which is how you would deal with most stressors that you would have, except that if it's chronically happening, then that can actually lead to your body overreacting and essentially putting you at increased risk for these diseases.
Wow, that is so interesting. There are many people who don't have access to being connected. As you mentioned, it's important to stay connected. Can you tell us about some of the challenges they face and how perhaps social programs can be beneficial?
Yeah, so sometimes people are objectively isolated. As I said before, you can be lonely even if you're not objectively isolated, but those people who are objectively isolated and lonely are really, they experience sort of it's a double hit. There are some programs that exist, and NIA is funding some research to understand these programs where we can leverage volunteer programs like Meals on Wheels, for instance, or phone calls to seniors in a community to just try to have a friendly interaction. Now, to the extent that those interactions can be used to actually help someone achieve their social goals. So like I was saying before, to sort of get out of the headspace where they might be worried about a social interaction and just really use that as an opportunity to re-engage, those can be beneficial for reducing loneliness.
Now, Liz, you mentioned getting out of our headspace. Is there something that we need to know about reframing our thoughts about loneliness?
Yeah, so many people, when they start to experience loneliness, it can become a downward spiral where, because they are feeling lonely, they might misinterpret someone else's an ambiguous social cue as being evidence that that person doesn't actually want to engage with them. And so then that can make them question themselves and not want to engage with that person socially. But then that other person wasn't actually thinking anything bad about them. And now the person who's lonely is acting weird towards them. And so they can actually disengage, and it can actually further the disengagement of the individuals, such that they eventually, the person who was just a little bit lonely and misinterpreted some ambiguous social cue actually has pushed people away, or people have pulled themselves away from that person, and can exacerbate loneliness. So it's important to reframe our thoughts and think a little bit more about, maybe that was not something that was negative towards me. Maybe I'm misinterpreting that.
Is there anything else that, those 50 plus should know just about this topic generally? Any other words of wisdom that you have that can help us?
It's good to talk about it. If you are feeling lonely, talk to your friends and family, talk to your physician. There are resources available. And because it does have a really outsized impact on your health, you don't want to just let this fester. You want to find ways to re-engage, to socially connect, and you'll benefit from it.
Well, Liz, there are still plenty of questions that I could ask you that I know our audience would like to know regarding this topic. Being lonely or isolated is an experience that all of us are familiar with at some level. The pandemic suggests that, as you started off with, and we can learn so much more. Is there a user-friendly website that you can share with us, or other resources?
Yeah, I would recommend that you go to nia.nih.gov. There we have a blog that you can subscribe to find out the latest research that NIA is supporting with respect to social connection and social isolation and loneliness. And there's also an entire toolkit of resources available. Also, the Administration for Community Living has a few different resources available as well, including their Commit to Connect, which is information about reducing loneliness and social isolation in your community, as well as their elder care resources locator, which you can use to find out about services that might help you.
Well, Liz, thank you so much for taking the time to speak with us. You've shared, again, a lot of useful information that I know will be helpful to the audience. And I hope that we can have you back on soon. And definitely, we appreciate you distinguishing between isolation and loneliness.
Thanks so much for having me here today. I really appreciate it.
You're more than welcome. Well, that concludes our program for today on mental health awareness. As you can see, the voices of those 50 plus matter every day and in every way. To learn more about services for seniors in Montgomery County, please visit the Montgomery County Seniors website by visiting montgomerycountymd.gov/senior, or call the Senior Resources Line at 240-777-3000. And as always, thank you for watching 50 Plus in Montgomery County.